Hi.
Dr. Hillary, we're
Hi,
talking
Dr. Sarah.
PCOS today, which you
I
happen
know.
to know quite a bit about.
Welcome to Doctors in Demand. And this is not just for women trying to get pregnant. This is for women living with hormone dysregulations through their lifetime and how we manage it as we age, right? So if you feel like, wait, I don't really care to know about PCOS because I'm not trying to get pregnant. It's such an important thing to know about
Mhm.
for managing your life if you have a hormone dysregulation. And this affects how many women?
It's like 1 in 10, 1 in 8, depending on where you look, but it's a lot of women who don't know they have it, right? People think, "Oh, I must be stressed. I missed my ovulation," or "I must not be eating well. I have acne here," or "I can't lose that weight," or "I just am having anxiety." And often it comes down to PCOS.
It's very commonly undiagnosed or
Mhm.
misdiagnosed, and Karen and I were talking about this previously. Like, this is what sort of kills us about the, like, just try to get pregnant on your own for 6 months, or and then if you're having a problem, it's like, well, wait, why can't we figure out what's going on with our hormones before we try to get pregnant?
Mhm. I wanna say something about that because someone just wrote an email in, to us at Hello at Cultivate Fertility saying, "Where can I get these hormone tests that you all are always talking about? Because I asked my OB." This really happened, I haven't even told you this. Something to the effect of, I asked my OB and they actually said, "Well, I could order the test, but I don't know how to interpret them." Hormone tests. We're talking, like, labs, basic blood work, hormone testing. And she said, "Can you believe that?" And it's true. I mean, this is not necessarily what is standard of practice for your OB. I mean, your OB is doing a lot of really important things as far as your screenings, making sure they're catching cancer early, making sure they're screening for all kinds of infections. They're doing a lot of things, and they're not necessarily set up for balancing hormones and regulating your hormone systems is my job. They're just not set up that way. So
It's
it was really interesting to me that the OB is so honest saying, "Well, I can order them, but I don't know how to interpret them. So you have to
and
go to
and
somebody."
that happens a lot. Like this, I just diagnosed a woman with PCOS who had had multiple doctors, and
Mhm,
and this is the problem with the, like, cutting off into parts, right? That
mhm,
the dermatologist treats the skin, and then the OB is trying to manage the hormones mostly with birth control pills. It's not necessarily a bad treatment for PCOS. It's just that there's often other things that happen. And they're right. They don't know, they're not looking for it quite as much
mm-mm.
because their treatment at the end of the day, whether if you are missing periods or you have wonky periods or if you have acne, they're not really, like, thinking about it. And OB is praised. I mean, Karen, I don't deliver babies. Karen, I do not know how to do a C-section. We've
No,
never
I
done
can't.
that. We don't know how to manage fibroids surgically.
No.
And so your OB does so many baller things
Mhm.
that, like, cute naturopathic doctors that work on hormone balance and are hormone experts, we don't do those things.
Wait, are
We
we
care
cute?
more
You're
about
calling us cute?
what I'm calling you cute.
You're cute.
No, you're cute. Look at you. I love your stripes.
Oh, wait, I wanna say one thing, though, about the pill for the PCOS, because this one drives me bananas. The
Bananas.
pill is not treating the PCOS. It is just suppressing your ovulation so that you don't have the symptoms. But once you go off the pill, you still have the PCOS. It's not treating anything. It's the Band-Aid on top. It's just like, let's push it down till you actually need to deal with it, whether that's when you're trying to get pregnant or whether you're in perimenopause or whatever's happening in your life. So that is a real issue that I think many women look back on and they say, "I've been on this pill for 15 years. Why did no one tell me that I have this underlying issue and deal
Okay,
with it?"
so there's a couple things that need to be gripped with the
Mhm.
PCOS. So this is what PCOS is: polycystic ovarian syndrome. I am the model of it. I have it,
Yes,
and
you
we are women who make a ton of androgenic hormones. So we preferentiate, instead of an estrogen dominant or progesterone balanced hormone profile, we have more testosterone. Now, all women have testosterone, and pound for pound, women have more testosterone than any other hormone, the average woman. But so for me, I have so much more than the average woman. So I genetically push, and women with PCOS genetically preferentiate that we make more testosterone, and we don't necessarily detox testosterone very well. So we just have more testosterone around, which impacts our stress hormones. It impacts our mental health, which then impacts our stress hormones, and it impacts our blood sugar regulation. So PCOS is also working in the blood sugar regulation sphere, and that damages our egg quality. So like Kara, this is what's so fascinating. Kara and I both, Kara had endometriosis, I have PCOS. We both had luteal phase defects. We both had egg quality issues for completely different reasons. The treatments were different.
And can I say why though? Like the real thing, and this brings us to the longevity piece. I just want to interject this, is because our ovaries are not healthy. Sometimes, mine was for endometriosis reasons, Hillary's was for the PCOS reasons. But if your ovaries are not healthy, you have all these increased risk factors for problems as you age too. So one of the things that happens is your progesterone, which your ovaries make, goes lower. So both for me and for Hillary, even though the way our hormones go are two totally different ways, like complete opposites.
And this, like what we've really realized is you can see it on labs. So yesterday I just got labs back for a girl or a woman I'm diagnosing with PCOS. She had acne. She did not have the telltale signs of hair growth. She was not obese. So many of us think about PCOS. Many of us were taught in medical school. It's really interesting. Like in medical school, you learn almost the extreme of the illness, and you don't learn all the gray leading up to it. And so if a woman presents and she's got central obesity, she can't lose weight, she's got hair growth, she doesn't have a period, then most doctors are like, ding, 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 this is something called PCOS, because it's like the classic way we learned. But it expresses itself in tons of other ways. Like it's like a bell curve, and that's the extreme of the bell curve. And everybody under the main part of the bell curve, like there's many types of PCOS. Like I never had central obesity. I might be working on it now with menopause, but like that before I never had that. And many of us are lean types. So we don't have the obesity. Did I have facial hair? Yes, I did. Did I have abdominal hair, which Kara's doing acupuncture on women, and you say that if you ever see abdominal hair, you know that in a woman.
I ask, because I get this interesting perspective, because how many people are looking at your lower abdomen? Often I'm doing those points on women. And so if I see hair there, I sort of like think, did we not rule this out? Let me make sure that I've ruled out the testosterone androgen excess scenario with this woman. And often it's the first time it's caught. Just do an acupuncture.
Just do an acupuncture. And so for many women, Kara has said before when we've talked about PCOS that we are not seeing this in our teenage patients, because teenagers are typically in medicine treated by their pediatrician. And then many of them don't ever go to an OB until they're sexually active, but that's often in their 20s. And by then, many of them are already on birth control.
Because they had something in high school and that was just the quick move to just,
or they needed birth control. Okay, so many of them don't want to get pregnant. They're sexually active. Okay. And so they go on birth control before they figure out what's happening with their periods. I mean, I had one period before I went on birth control. And I went on birth control because I didn't have periods. But at the same time, I was like, I would have found it out anyway. Like I was working with my OB and my OB didn't say you have polycystic ovarian syndrome. He just said, you have amenorrhea, probably because you're so athletic.
Mm-hmm.
But that wasn't true. It was because I had a ton of cysts on my ovaries.
You're very athletic because you have more testosterone than the next woman. So your muscles are really good. You have good musculature. Yeah, you do. Like your back, you have back muscles. You do have good muscle form.
And that's the thing with girls with PCOS. So now I can pick them out in a heartbeat. They come into our practice or and I can just say that one's got it. This one's got it. We just diagnosed a really cutie that we're working with that has never known that she had PCOS. High testosterone, high DHA, and it doesn't necessarily need to be above. It can just be trending high insulin, trending high blood sugar, right? So there's these insulin blood sugar issues, and that's the big longevity piece. That's the piece that's impacting ovary. That's the impact that we have long term, where we're not ovulating with a healthy, good egg.
Right.
We're not making, and some of that's because we don't make enough estrogen. But like, if our ovary is not healthy, we're going to have long-term longevity issues.
Yes. And it comes down to diet and exercise and the nutrition is very specific for a PCOS person. They need more of specific antioxidants, specific micronutrients. They need a ton of protein. There's a real specific way of eating that can help you control this, that it's such a shame because when it's first diagnosed at the OB office, that's not it's not the nutrition discussion. It just is not happening there. And very often, Hillary, you and I have talked about this so many times with the fertility patients, where then we're dealing with a fertility patient who has PCOS and they just want to get pregnant, but they've never actually really dug deep on the diet and exercise plan and nutrition work. They've just gone to IVF without any of that done. And so ultimately, that's the discussion we have to have with a lot of the people we work with. And it's such a shame in our system that that's not, part of it. There should be an automatic prescription of this much exercise. This is how you have to eat, et cetera, when you get the diagnosis.
And women should just be diagnosed earlier. So if you didn't have infertility, you couldn't have PCOS.
Mm-hmm.
It's this way of looking and assessing your blood sugar metabolism and your hormone metabolism. And so we need to just kind of understand, we're just both making the case for, as we age and go through our fertility years, our perimenopause, our menopause years, we need to know what our hormonal influences, like how we express hormonally. And that's like that OB saying, and that's just the one OB. Like, I'm not sure how to interpret this data, right?
Mm-hmm.
And like, me knowing that I have higher testosterone and me expressing it in my relationship, it helps. Like, I go to anger more easily than Kara.
Never flipped anyone the bird.
I flipped somebody the bird.
Never.
I flipped somebody the bird. And it's because I get and that's one of the ways I diagnose women with PCOS, right? It's like, do you get road rage?
Mm-hmm.
Do you have a heart to love? You have a big spirit, but do you have this underlying agitation, irritation? And Kara, I had an eating disorder. And when Kara came back with the research, oh my God, she's digging around about PCOS. And she's like, do you know that so many women with PCOS are predetermined or much higher, more likely to have an eating disorder because we're running lines of anxiety. I had no idea, but what a relief. There's just sometimes relief in our hormone.
And figuring out, I have the tendency to be more snappy, or just the emotional state whereby you're more likely to develop an eating disorder. That is a good thing to tell someone and to let them know. Yes.
Tell these teenagers and 20 something. So if you're listening to this and you're a teenager, or if you're listening to this and you were put on to birth control as a teenager without understanding your hormonal setup at all, like if you didn't have a lot of periods or they were very sporadic and you just went on the birth control pill, you're not having periods. You're just having withdrawal bleeds from the birth control pill. So you want to understand what's happening. Do you have high insulin? Do you have high blood sugar? Do you have a tendency towards having improper stress hormones? Because those are going to have a long-term impact on your fertility when you go to get pregnant. So I tell a teenager now, if I diagnose her with PCOS, she goes onto the pill and I'm doing a bunch of stuff, but off she goes into her life, right? I'm telling her, you need 3 years before you want to have a baby. And that's like a good thing to have in the back of your mind. Like it's going to take you longer than your friend. It's going to take you longer. You're not going to be able to get off the pill and turn around and get pregnant in a month or 2 months. Like that's not going to happen for you because there's tissue repair that needs to happen, right? But if she knows she has PCOS, then she should be doing the diet work all through college in her 20s that helps to preserve egg and ovary, right? So that it's easier for her to get pregnant.
Right. Less inflammatory, less blood sugar issues. It's just, it's a good way to eat too, truthfully. All right, lovely. I'll see you next time.
I just want to say that I wish that we were spending all day together and that I love you in my life. And I'm really glad to do this. So, and I hope
I love you too.
Has somebody that they love. Tell people that you love them today. It really matters.
It is. It's really important to tell your loved ones that, hey, I just wanted to say hi. It's nice to hear your voice or whatever. Just like making that phone call makes me feel better. So
if you made it to the end of this show, maybe go stop right now and go make a phone call to someone you love or send them a text message. Make somebody's day brighter.
All right. Bye-bye.